Welcome to Spectacle on Television Nigeria. I am your host, Daniel Atai. China endorses Avigan or Favipiravir drug for coronavirus treatment. Welcome to Spectacle, your socio-political and economic program on Television Nigerian. I am Daniel Atai. Please stay tuned. After this timeout, I'll be with you.
Rose written by a Chinese researcher tell the truth about coronavirus. He is now at risk of arrest. Hi, I'm Zhao Shenmi Minzi from China, a researcher at the Faculty of Medical Sciences, Zhanjiang University. Coronavirus arrives in any country sooner or later. There is no doubt that many countries do not have diagnostic kits or equipment. Please, use as much natural vitamin C as possible to strengthen the immune system. Don't worry, it is a simple virus that you can get rid of. Unfortunately, the virus does not currently have specific vaccines and treatments, because of the genetic mutation that made it very dangerous. This disease appears to be caused by gene fusion in a snake and bat and has gained the ability to infect mammals, including humans. It is important to keep calm and convey this message. Professor Chen Horin, CEO of the Beijing Military Hospital, said, "Slices of lemon in a cup of hot water can save your life. The hot lemon can kill the proliferation of this virus in our bodies. The lemon is cut into 3 parts and put in a cup, then pour the hot water and it will turn into alkaline water. Consuming this water every day will definitely help you against the proliferation of this virus. Warm lemons can have the same beneficial effect as medicines. Treatment with this extract destroys the virus and cures the flu. In addition, acids and carboxylic acid in lemon juice can regulate hypertension, protect the narrow arteries and reduce blood clotting." Professor Chen Horin noted that anyone who receives this message is at least guaranteed to save someone's life. "I did my job and I hope you can help me develop myself. My name is Marian Gorban from Mr. Healthy Channel and I hope you found this message helpful."
Welcome back. We are talking about the newly drug known as Favipiravir, confirmed by China to be effective in the treatment of Covid-19. The global virus that threatens to shut down the world and its economy. China's health leadership have announced they have found the Japanese-developed anti-influenza drug, Avigan, to be effective in treating coronavirus patients. Zhang Zimin, the China's director of the National Center for Biotechnology Development, confirmed that the Avigan was found to be effective in 2 clinical trials completed in Wuhan and Shenzhen, involving 320 patients in Beijing on Tuesday, 17th March 2020. Zhang said the medicine worked for coronavirus-related symptoms, including pneumonia, and had no obvious side effects. It has a high degree of safety and is clearly effective in treatment. Patients who were given the medicine in Shenzhen turned negative for the virus after 4 days of therapy, compared with a median of 11 days for those who were not treated with the drug. Public broadcaster NHK said, in addition, X-rays confirmed improvements in lung condition in about 91% of the patients who were treated with Favipiravir, compared to the 62% of those without the drug. The director said he formally recommended the use of this medicine as a way to treat the COVID-19 disease, which is caused by the SARS-CoV-2 virus. According to Zhang, a Chinese pharmaceutical company has been approved by the National Medical Products Administration to mass produce the medication and ensure a stable supply. Ever since the coronavirus broke out from Wuhan in China, almost 200,000 have been infected and 7,900 have died from the disease. Effect of Favipiravir treatment on viral loads in guinea pigs. In the first in vivo efficacy study. 3 guinea pigs per treatment group of 150 or 300 milligram favipiravir per day and 50 milligram of ribavirin per day were utilized for sample collection on day 12 post-infection, a time when control animals were displaying signs of terminal disease. The sample shows infection was higher in A, serum, B, liver, C, spleen, and D, lung, where the probability P of the sample shows P less than 0.05 for the first sample of 150 milligram, and triple probability P of ribavirin 50 milligram per day used gave a probability of P less than 0.001. This refer to statistically significant as the first probability P of 150 milligram and 300 milligram used gave probability P less than 0.05, and the second probability of 50 milligram per day became statistically highly significant as P less than 0.001, meaning that less than 1 in 1,000 chances of being wrong. That is the effectiveness of the drug. And that is to say, no cause for alarm. The drug is effective against COVID-19. Let's take a quick break with this insightful video, and when we come back, we shall be discussing with an expert and a pharmacist on this case. Please stay tuned. In the office of pharmacist Basil Akpaka to inquire about the new drug called favipiravir, which has been discovered to be effective against coronavirus or COVID-19 virus. Sir, good afternoon.
Good afternoon for having me.
Okay, this is Spectacle in your office.
You're welcome, please.
Now, the drug Avigan or favipiravir, is it in Nigeria now?
Speaking about Avigan, Avigan was first introduced in Nigeria in 2014 when we had the Ebola virus outbreak. Okay. And as at then, it was used in combination with ribavirin to be able to tackle the Ebola virus epidemic right then. But then after that period of 2014, at a point, we depended solely on ribavirin and some other medications to be able to tackle that. And as of today, it is not widely available in the country. It is widely in use in Asian countries, for example Japan and some areas of China as well. They made use of it of recent time. But then talking about the availability in the country for now, it is not readily available everywhere. That is the truth of the matter, and that is the truth on ground now.
In that case, what could that mean? Since coronavirus, we have some cases, about 12 cases of coronavirus right now in Nigeria. Does that mean that Nigerians are going to die in the absence of this drug? What could be done now since the drug is out?
With the non-availability or the drug Avigan not readily available for now, Nigerians are not going to die. There are other alternatives which we can be using for now, and precautionary measures which can put in place depending on when this drug is made available. And remember that whichever drug that is going to be used in treating a novel disease have to undergo a particular level of clinical trials before they will be approved finally for use to treat a particular virus. Today, as we're speaking today, coronavirus, which is COVID-19, is not just an epidemic, which is at a particular location localized.
Yeah.
It's a global, it's having a global impact, which means it's a pandemic. It's having a pandemic effect.
What are the differences,
Now,
epidemic and pandemic?
Now, when we're talking about epidemic have to do with a disease that is within a particular, restricted to a particular region, a particular country, a particular geographic location. But when we're talking about pandemic, which means it's all encompassing, it's all over the globe. It touches all the continents around the globe. That's when we say it has now become a pandemic.
Okay, continuing what you were saying.
So, as I was saying before, this drug, even though it has been proven to be effective in some other countries, like Japan, who have been able to make use of it and they've been getting some results, although they don't want to come public with it because for every drug to be made to be available for public use, first to be manufactured en masse for public use, we must ascertain some other, especially the side effect and adverse effect of this drug with respect to the health of woman after you must have finished using it to tackle the disease. So that's why it's taking some time for it to be approved. And once it's approved, I know that the World Health Organization and other health experts have what it takes to be able to make sure it's readily available all over the world.
Chinese government has already approved it for being used, that it could, they say the efficacy from the formula they gave, maybe you have to explain the formula. They said 300 milligram of it was sampled on guinea pig, 150 milligram and 300 milligram was sampled on guinea pig, and then later, within 4 days, and then within a period of reaction of 12 days where animals react to terminal diseases, they used 50 milligram of it, and then they discovered that the first use has a probability of less than 0.05. Then the second use have the probability of which is probability less than 0.001. So what does this efficacy of this probability means? Because already they have said it can be used now treating the virus, and over 50,000 persons with the favipiravir were completely discharged from the hospital. So, in a nutshell, what is the chemical compound of this? Do you have any chemical compound of it here in Nigeria that people can use for now to survive, pending when the 1.1 trillion that the CBN dished out, the virus called COVID-19, could be used properly?
Okay. Thank you. Favipiravir as a drug has its first use in 2014.
Okay.
And the truth is that, but with respect to COVID-19, we see it as a new drug to it.
Okay.
So it has been tested, and the success and the significant interval has been determined.
Yes.
The first one as 0.05.
Yes.
And the second one as 0.001. Which means that as for the first test, it was the significance of significant interval was highly successful in the first one compared to the second one, the second test that was carried out, because 0.05 means a higher successful interval. But having said that, you see that the availability of this drug is dependent on when it is fully approved by FDA, World Health Organization, and then our own NAFDAC before it can be able to be shipped into our country for use to take care of this COVID-19. And the truth of the matter is that rumors have been flying around with respect to other medications that have the capacity to take care of coronavirus. You understand? But then the FDA and WHO are still warning that yes, these medications or drugs like favipiravir might have had a clinical better outputs with respect to patients that have been down with coronavirus, and from what I've gathered, 91% of people that it was treated with left the hospital and were well. But then we haven't been able to determine the side effects. The adverse effects on the patients that this drug has been used, although they have been found to be healthy and well to go. So that is why its availability in countries like Nigeria, especially African countries, is they are still trying to withhold it. So they'll be able to determine, yes, it has been carried out in guinea pig, it was good in guinea pig and all this. But also there are various stages, there are about 4 stages of clinical trial that this drug have to undergo before it will be pushed out for production in the market.
If you look at the log table for the clinical trials on guinea pig, you see the efficacy of the drug. And in 1,000 cases, it has come out claimed to be very effective. And on human, we have recorded in China precisely 91% efficacy to release this thing massively, like Chinese government has already ordered massive production so that people in this part of the world, since it's a pandemic, can begin to have access to this drug. And while we wait, which other alternative drug do you think people who are already been affected could use as a pharmacist?
The truth of the matter is, like you said, that WHO and FDA should be able to hasten up the process, fast track the process of having this drug to be available for use. Because already, you know that Africa, although the disease have overwhelmed countries that are highly advanced, their health system is highly advanced. Talk more or less of African countries which are still battling with poverty and all whatnot. So with that, you find out that the earlier WHO and FDA are able to fast track the process of approving this drug, the better for countries in Africa. But then, having said that, it is also important for us to note that I think that was yesterday on CNN, the President of America, Donald Trump, said something about chloroquine being looked into by the FDA in the US, so that they will be able to see how effective it is. Although he said that that the drug has some positive therapeutic effect on patients who it has been given to, but they are finding a way to be able to work with FDA to fast track the process of producing ascertaining if this drug is quite healthy for use in humans. But we in Africa here have been using chloroquine for a very long time, and although we have some side effects with respect to that, hypoglycemia is one of them.
What is hypoglycemia?
Hypoglycemia is a condition where there is a low level of glucose in the body system for a patient, because the brain actually needs glucose to be able to be maximally functional. So when there is low level of glucose in the body, we'll say the person is hypoglycemic. You understand? And
what could that result to in the patient?
If the person is hypoglycemic, it may result to the person being unable to concentrate. So a person may may collapse. That's what we call syncope. May have a syncope. You understand? That is, the person may collapse, won't be able to do some other things and become unconscious in that condition. So, but the basic thing we should be able to look out for is that whatever we are trying to approve or whatever we are looking out for to be a remedy or a drug that will be able to take care of COVID-19, as it's called, we should please as well look at the other side of it, which is the adverse effects we'll be having on patients. And that's why, very important, please, these drugs which are being marketed as possible cure alternatives and cure or preventive or cure to coronavirus, which is COVID-19, should not be used just like self-medication. And it is not these drugs are not preventive therapy actually. They are marketed, we are looking at them potentially, not that they have been approved, but looking at them potentially as curative therapies. Yeah. So it means that if you're healthy and you haven't been tested or confirmed positive with COVID-19 virus, there is no need of you taking this drug. Okay. It is only those who have been confirmed that they have that positive with this, that then they should be able to look out to see if the possibility of using these drugs on them. And again, importantly, please, we shouldn't be so fast in using these drugs because some other countries use them. if you look at it very well, you find out that they haven't been able to publicize the use in the media, or even allow WHO to talk about it. WHO have knowledge that these drugs are being used, but they still have created a room for it to pass the normal stages of clinical trials, so that they will be able to safeguard people's health in the long run. You may use today to take care of a particular ailment, which is COVID-19, but you don't know the adverse effect you'll be having like in 2 months and 3 months time. And these clinical trials, if you want to ascertain their potential hazard on people after use, it takes at least 9 months for it to be done, at least 8 to 9 months and a year for it to be done, no matter how fast they are. So that's why we are advising, please, that if we are falling back to using this drug, that it should only be used in places where medical personnel are on ground to be able to oversee and ascertain what quantity or what preparation of them is adequate and is good, is okay, is good enough to be given to a particular patient. Good that we don't go to taking care of coronavirus or COVID-19 and have ourselves back into something else, which is trying to save the person's life along the line. So these are what we are looking at. Please.
Right. No, okay, good. Right now, the federal government of Nigeria, through the CBN, Central Bank of Nigeria, has released about 1.1 trillion to fight coronavirus in Nigeria. Which process do you think